Hello, this is Dr. Katie from Craig Chiropractic and Kinesiology. Now, it's been a while since I have made my last video, and I decided to jump on here and have another office chat today. So this is just going to be an informal talk, and I thought, with this time of year, it might be nice to talk about cold and flu season, the recent upper respiratory virus that seems to be going across the country, particularly the Midwest, but other parts of the country are seeing it as well. And I wanted to just take a moment to discuss that from a chiropractic perspective, and also just to take a moment and discuss the difference between traditional medicine and alternative medicine, because that's something I've never really talked about on this channel. And I thought today, let's just have a conversation about it. So on these topics, now what do those have to do, or how are they all tied in together is the great question. So just to briefly explain, recently myself, I got a fairly bad upper respiratory infection. Now, ironically, right before I got this infection, I had just released my video on this channel on natural things for immunity and how to help fight colds and flus at home naturally. That's just how life works, right? After I released that, I get sick myself. And you know what that is like, and you can do everything right. In the alternative medicine world, we can get adjustments, we can do acupuncture, we can take all the right herbs, homeopathies, home treatments, tricks. You can still get sick, okay? That's not to discourage anyone, but it's always, hey, you try everything that you can, and some of these bugs are just really nasty. In the last few years, especially since 2020, as doctors, we've just seen a difference. Now, this doesn't mean there's anything to be afraid of, but it means that some of these viruses and so forth are just a little more aggressive. Okay, now for myself with the upper respiratory symptoms, I did a lot of the remedies that I shared in my other video. So if you're curious about that one, certainly head back over to my channel. And that is one of the last videos published, if I remember correctly, a little bit longer. So anyways, I got this upper respiratory infection. I was at home off work, and very challenging time because, obviously I did not want to work and treat patients because I was infectious, of course. And then also I was very, very miserable, even with all natural remedies and doing everything that I could. It was challenging to breathe. There was no energy, things like that. So for me, after 5 days or so of very little to no improvement, being, let's just say, very, very miserable, a lot of pain, trouble breathing, just inability to break up phlegm, using every means I could. I was doing a lot of things like poultices, natural expectorants, things that normally work very well for me suddenly were not working. So I knew that this was more than just my typical upper respiratory infection. Now, here's the part where I kick myself a little bit. I am a natural doctor myself. I have my own stethoscope and equipment, and I was very tempted to grab a hold of my own stethoscope and just listen to my own lungs. But I didn't do that. It's hard to always advocate for yourself and think straight when you are the patient and you are sick and ill yourself. And, part of me is like, maybe I could just do that and just see how my lungs sound. I couldn't really tell. I'm like, they're not as bad as a bronchitis, but they're definitely, it just wasn't good after 5 days of not improving. Okay, and at that point, even with the best home remedies, the best, most potent herbs and homeopathies, you want to be careful of things like pneumonia, especially if there's a lot of phlegm in the lungs that will not clear, even with traditional methods that work. So that was my concern. I didn't want to panic about it or be dramatic about it, but I also wanted to take it seriously that is not a good route to go. And if that does happen, it is time to go seek traditional medical treatment. It might be time for an antibiotic or something else if appropriate. Now, at this point, I was not aware that what I had was viral. Okay, I was unable to identify what the bug was. It was very different than anything else I had had before. And anyways, getting to the point, I talked it over with my husband, and we just decided it would be best to go to urgent care, get their opinion, and potentially get me on a prescription that may be helpful. Okay, now any of my friends or people that know me know that is not my first choice. I always try to do things the natural route whenever I can. All right, I'm a big advocate. I also know that when things are called for, it's a time and place to seek traditional medical treatment, and it has its purpose. Antibiotics have their time and place. Mild steroids have their time and place, they do. And I was at the point where I was willing to do that. Now, previously in the past year or so, I have contracted some other viruses which have needed some medical intervention, and thankfully my PAs and practitioners were phenomenal. They explained everything very well, what we were doing for treatments, and it was all beneficial, and I could do all my natural treatments right along with it, and I got fairly good results. Now, I would love to say that my most recent visit to urgent care was the same, but it was a little different, and that's what made me really think about, hey, let's just talk about the difference in the two medical worlds, okay? I just want to talk about it. Maybe you're not aware of the difference. When I went to this urgent care appointment because of my lungs, right? So I had been miserable. I had been doing everything. I'm like, this is not a normal bug. I want to make sure this isn't something worse, and if I can get help, because nothing was really helping. So I go in for my appointment, and the PA I had, she was very pleasant, very friendly. You know, you have to book ahead of time. You get your 15-minute appointment, and she maybe talked for me for 2 minutes, and that was stretching things. Now, I appreciate that some appointments are very quick and they don't need as much talking, but it's like, you know, I needed some time to talk. I have a fairly complicated medical history myself, and it's not normal, okay? I'm a great case study for any doctor. And I'm like, okay, you need to understand that there's these complications and I can have these types of medications and there's just different things. And my PA was just so quick just to not really do anything. You know, she tried, she offered to listen to my lungs, and thankfully my lungs sounded clear, meaning most likely not pneumonia, which is wonderful. That is what I wanted, but I was a little disappointed because I could have grabbed my own stethoscope and just did that. But it's like, you know what? You'd rather be safe than sorry. And with me being so sick, I'm like, kind of hard to always advocate for yourself. So I'm like, fine. She listened to my lungs. That was wonderful. Great. Thank you. Well, then she said the only other thing she could do is potentially order an x-ray, which at this point probably wouldn't show anything anyways because the lungs sound clear. So traditionally you take an x-ray for pneumonia to see if you can see fluid buildup in the lungs. At my point, because we can't hear any fluid, that would just be an additional expense that would show nothing. So I'm kind of politely like, that's a waste of time. Let's not do that, you know. Added expense that's not going to help. So I'm like, all right, that's fine. What are our other options here? And anyways, the PA told me it's most likely viral if it's not, you know, bacterial pneumonia. She's like, okay, that's fair. And with some of my symptoms and so forth, that could make sense. A lot of viruses going around. She didn't really know what type of virus it was. There was no other additional testing that she was offering. She didn't even offer anything for my comfort, like a painkiller, a prednisone, anything. It was just basically go home and wait it out. And yeah, these kind of viruses just suck, is essentially what she told me. And I was a little frustrated because number one, I'm miserable. I'm trying to advocate for myself. And it seemed like I was almost inconveniencing her with my questions. Like she was ready to just leave the room after listening to my lungs, and like I had additional questions, and it felt like I kept keeping her from leaving. So it's like, okay, well, I don't want to inconvenience you. You know, our instinct as humans, right, is to, well, I don't want to inconvenience you. That feels wrong. But it's like, hey, I'm paying you as my medical provider to help me. I can't figure this out on my own. Can you please help me? I'm miserable. And instead, I mean, she was trying to be sweet and polite, but it seemed like she was in a hurry to her next appointment. And again, we were not overtime at all. We still had like 13 minutes left out of a 15-minute appointment. And anyways, when I asked for, okay, that's fine, it's viral, obviously with a virus, antibiotics not gonna help that, makes sense. Don't wanna accidentally get put on an antibiotic when you don't need it. Of course, I fully advocate for that. So then I asked her, I have to stop her from walking out of the room, and I'm like, all right, what can I do for symptom management? Like, anything you can give me, anything that could help me, I can do at home. And she literally just looked at me and said, oh, hot honey water. And I'm just kind of like staring at her like, yes. And then she starts going into how modern research has showed that honey water is wonderful for coughs. And I'm like thinking, Yes, it absolutely is. That's wonderful. Here's what I'm going to say for that. If honey water would have been working, I would not be at that appointment in urgent care. And believe me, honey water is phenomenal. It's great, wonderful for coughs and flus. However, it's not the only thing. That's just scratching the surface. And what I had was very severe symptoms, if I may say so. And I can honestly tell you that just some hot honey water would not have been enough to help my cough or basically manage any of my symptoms. Like, I have been doing some of the most potent herbs I have, poultices, natural expectorants. I've been doing plenty of honey, garlic, turmeric, like all of the very wonderful blends for coughs, apple cider vinegar, throat coat teas, breathe easy teas. Like, I'm doing all of that stuff and more. And all she could tell me was just do some lemon honey water, or she didn't even say lemon, it was just the honey water, nothing else. Like, that's gonna help me. And basically told me if I didn't feel better in a few days to come back, and then she would give me something to help me feel better. And it's like, I'm here now for help to feel better. Like, I have been doing all of this stuff on my own. Like, with all due respect, honey water is not enough at this point. And I appreciate the traditional medicine route trying to do something that's natural, but I appreciate that they advocate for honey, that honey is that is a great place to start for adults and kids over the appropriate age, of course, but there is so much more that you can do for symptom management. I mean, I have been to so many other appointments in my life with traditional medical providers, and they push so many different prescriptions on me. Like, I couldn't walk out the room without getting a painkiller or something getting pushed on me, and I'm like, this is the time where I'm like asking for it, and I didn't get anything. So because I am between insurances and I'm a cash patient, I literally paid $300 for a 2-minute appointment to get my lungs listened to. And got told to drink hot honey water. I was kind of speechless when I left. I wasn't happy. Listen, the PA did her job. She did everything by the book, but it's just, we talk about in the natural health field how people want to feel heard by their practitioners. They want to be taken seriously. They want somebody that takes the time to hear them. If you schedule an appointment for 15 minutes, you're getting all or at least most of that 15-minute appointment dedicated to listening to you, your problems, how they connect, kind of connecting dots with you, thinking it through, what's happening, problem solving. Like, that's what we do as chiropractors. I'm not trying to brag, but it's like we spend our time advocating. Even if we don't know the answer, it's like we will help you problem solve. We will refer you out. We'll be like, oh, that's interesting with your medical history. I could see where this ties into this, or let me do some research on that and I'll get back to you. Like, there's something like I always hope that my patients walk away feeling heard. That is always my goal as a doctor, to be more educated leaving than when you come in. And I can just say, with that urgent care and that provider, I didn't really feel heard. I felt like they were just rushing through the appointment. When I shared very relevant, very important medical history, they just kind of blew it off like, oh, okay, like that's not relevant. And I'm like, I think this is absolutely relevant to this discussion and why I'm probably so sick and why I have a weak immune system. But anyways, that is to say, traditional medicine, for those of you that are not familiar, that is what you think of traditional medical doctors, nurses, PAs, etc. You go to a clinic, you get a prescription, vaccination, you might go to a hospital, get a surgery. That's your traditional medicine. I'm a chiropractor and also an acupuncturist and applied kinesiologist, so I work over in the alternative medicine field. Okay, so we don't use prescription drugs, we don't do surgery, and we don't provide vaccinations. What we do work with is things like chiropractic adjustments, acupuncture treatments, herbs, homeopathies, nutrition, muscle work, emotional work, and even more, okay, to be able to help you. So anyways, those are the two fields, and that was just to basically wrap up this entire chat. If you are still listening to this, thank you. This is just me sharing kind of, as doctor to patient, but also just as patient to another patient, as what it's like for me to be a patient and feel for all the patients out there. You want to feel heard. I want to feel heard. I want to feel like my provider actually listened to me, actually understood me, actually cared about me, and was actually trying to help me, not just get on to the next patient. And you know, I think that is a big difference. I do not mean to knock all of traditional medicine. There are still some wonderful doctors, nurses, and practitioners there, but a vast majority of them, unfortunately, it is the exact experience I just described with my PA. And that is just very, very sad from a patient standpoint. And I really, really hope that we can see a change there. And for my patients, I really hope that you feel heard, that I create an environment so that you can feel heard and that we can help you feel better. And I will say, just as one final wrap up, I know this has gotten long enough as it is, but as for anybody who is concerned, so like what happened after I left urgent care and they didn't help me and I was not feeling well, I went home and just really hunkered down on my own supplements. I do something called muscle testing as applied kinesiologist, so I was able to teach my husband how to do it on me. So we were able to come up with a regimen, and I was taking very potent supplements every hour. I was doing poultices. I just really upped the ante on everything I had, and I wound up kicking my own bug. This was not a watch and wait situation. I basically had to nurse myself with the help of my husband, and thankfully I have a stockpile of herbs and supplies at my house. So that is how I kicked this bug, and I'm pretty sure that is how I kept my lungs clear. Because I'm pretty sure if I was not doing everything I did, my lungs probably would not have been clear, and they probably would not have sounded so good when I went in. So anyways, I am fine. I am now, I can safely say, fully recovered from this bug. Thank you for listening to this, and stay tuned for our next video. All right, bye guys.